Hey everybody, Dr. Ben here at the Functional Medicine Center, and today I'm going to go over can we actually boost our immune system, and is boosting the immune system even something that you want to consider or that you want to do? The immune system is an amazing part of our body. It's going to be what is going to help us be able to fight something off, rev up, attack, destroy, get rid of it, but then we also need to calm it down. The problems with boosting the immune system for some people is that if they have autoimmunity or some other issues where that immune system jumps up but isn't calming down appropriately, that's where a big part of the problem comes in. So yes, we need to help support the immune system, nourish the immune system, make sure it's working like it should, but do we necessarily want to boost it? That's that $1,000,000 question, and it's an individualized basis. We talked about this a few weeks ago in one of the videos where we were talking about phase 1 and phase 2 of COVID-19, and the phase 2 is something that they're seeing where there's this cytokine response and where that immune system is actually revving up, and that's one of the reasons why they were seeing certain people die in that second phase of the infection. So taking something like echinacea or something that's actually going to stimulate the immune system may not be the best choice at that point. So really what we want to think about when we're talking about the immune system is we want to modulate the immune system, and we want to nourish the immune system, make sure it's working appropriately. Meaning, here my screen won't do it, but it's basically a teeter-totter, and that teeter-totter we want to turn up when we get to the time where something's coming in, a virus, a bacteria, a parasite, anything like that, or we want to turn it down when we are too revved up, or when the infection, we want to calm it down. If it stays revved up, that's the problem we get with autoimmunity. And so the immune system is going to attack and attack and attack, and eventually we're going to start attacking our own tissue. So what we've got to do is we've got to stabilize and modulate that immune response. And that's one of the great things about vitamin D. Vitamin D helps modulate that immune response. Certain things are going to bump it up and nourish different sides of that teeter-totter. And so green tea can do something versus mushrooms can do something. And so there's certain things that are going to be able to turn things up and turn things down. But what we want to think about this point in just the basics of immune system is how can we modulate that? Even Dr. Fauci, he's the guy that they put up, and he's the expert in this day and age of everything that's going on. 4 years ago, he did an article in the Washingtonian. It's basically a journal article magazine back east, and he said, how can we nourish and support our immune system? And he talks specifically about vitamin C and vitamin D, and that he takes 1,000 milligrams of vitamin C a day, and that vitamin D, so many people are deficient. This may be one of the reasons why we're seeing people of darker color, African American descent, having more issues with this virus right now. I don't know if you've read that yet, but it's not just because they're overweight or obese or poor socioeconomics or whatever it is, but what we know is that people of color are not getting as much vitamin D in from the sun. And so the vitamin D levels of African Americans are lower than lighter skinned Americans. So vitamin D is absolutely crucial for that immune response, crucial to modulate that immune system. Yesterday we talked about how we need to know what our vitamin D is. So if you have not had your vitamin D tested lately, you've got to have that done. Go to your doctor, do whatever you can do to get that vitamin D tested, and you want to be between 60 and 80 is where you want to be on that vitamin D level. If not, you've got to get it up to the level where you need to. So it's crucial. We see people low all the time. You've got to get that vitamin D. So can we boost our immune system? Sure, there's certain things that we can do to jumpstart it if you look at echinacea and some of these things, but for a lot of people, it's not really even necessary. So as you get ready to go back to work, as you get ready to go back into the real world, go to stores more, go out and be with friends, whatever it is, you need to make sure that your immune system is modulating and is working well, and not just go, we got to just push it and drive it the whole time. That's not going to be the solution for the vast majority of you. We need to help support and nourish that immune system. And so that's what we've been talking about, getting the proper sleep, getting the proper nutrition, fruits, veggies, keeping that blood sugar stable. All these different things are going to be crucial for this. But think about, as you start thinking of going back to work, going out into the world, interacting with people, shaking hands again, all those different things. What barrier system does your body have that's going to be able to... And that's actually, if you think about it, our immune system, we have a barrier system and immune system on our skin. And that's one of the reasons why, unfortunately, a whole lot of hand sanitizer is not good long term. That'd be like if you go out into your garden and you start spraying it down with bug killer insecticides over and over and over, and eventually you won't have worms, you won't have microbes, you won't have any of this stuff, and it'll be sterile, and it won't be able to nourish your fruits and vegetables and things that you're growing. Same thing with our skin. Our immune system is part of that process, and so we've got to be able to still maintain that. And that's the great part about digging in dirt and letting your kids go outside and play. And Dr. Josh Axe, a friend of mine, he wrote the book Eat Dirt. And the reason he did, because it's so important that we do get exposed to these germs and microbes. And that's actually one of the reasons why in the old days when people used to get measles, mumps, chickenpox, all of that, it would actually be beneficial for their immune system long term, even though it was like, oh my gosh, we got to get rid of those diseases. And when I was a kid, I had chickenpox, and I guarantee you my immune system is better off because it was exposed, it practiced, it got a lot more of these germs coming in. So that's one of the concerns that I have with this whole anti-germ thing that we're going to be coming out of. And obviously we don't want people sneezing on each other, and you should wash your hands and do these things. But ultimately, we can't get overzealous and knock out all the germs, all the things that we need to really be able to function as a healthy person. There's a lot of research showing that the more kids play outside and play in the dirt and get exposed to microbes and germs and different things, actually the better their immune system is and the less they have of allergies, asthma, things like that. So we've got to get exposed to different things, and to just get total quarantine and hose everything down with Clorox and bleach and all these different things, that is not the solution. That is not going to get us to where we're going to be able to function in a good, healthy environment. Megan, hey, how are you? What are pregnant women supposed to take, or what do you recommend for kids? So vitamin D is totally a good usable vitamin for pregnant women and for children. Obviously, you want to speak to your pediatrician or someone that's overseeing the blood levels, and you want to test those on a regular level. But yes, vitamin D is totally safe for kids or pregnant women to take. There's certain things that you don't want to take as a pregnant woman, like oil of oregano, some different things like that. But for the most part, the C, the D, vitamin A, some of those, again, I can't give medical advice specifically for your family, but those have been shown in research to be okay for women and kids to take. So absolutely, it's just smaller doses, and you've got to work with someone that's going to help you through that process. So great question there. How much zinc and C for kiddos, Stacy? What a lot of people end up doing, unfortunately, is they'll be like, oh, I give my family emergency, and that's the packet of the sweet tasting of vitamin C emergency, and it's got a lot of sugar in it. It's really not the best source in there. But for most people in the kid range, my kids by age 12, they're most of the time 130, 140 pounds, so they're as big as an adult. So that's different than like a 4-year-old. But for a lot of people, the vitamin C in that 500 to 1,000 range is going to be a good level for a lot of people, and then even at the lower end for kids. But again, it obviously depends on their size and those things. And then zinc, again, it's gonna vary depending on what kind of zinc as well that you're taking. The kind that we use is 15 milligrams per capsule, and so depending on how deficient somebody is, and you can even look at that a couple different ways. There's a zinc taste test where it's a liquid zinc, and you do a taste test, and the less you taste, the more zinc you need. So some people dose that way. You can also look in the micronutrient blood test and see where zinc levels are that way. So that's going to be the most specific, but for a lot of people in that 40 to 50 milligram range is where they'll be taking that zinc. We've been seeing over the weekend, and on Monday it got released. USC, University of Southern California, they reported on a study they've been doing with antibody testing in LA County, Los Angeles County. And what they were looking at was how many people have had antibodies, have been infected by this. Surprisingly, LA County has only had 663 deaths as of when they did this report. When you look at even the number of people in LA County, I didn't even look it up. If somebody Googles that, look up how many people are in LA County total, it's got to be millions and millions and millions, and yet only 663 people have died there, according to the statistics from COVID. And that was in Los Angeles County. 15,140 confirmed cases, 663 deaths. They were looking at upwards of 5.4% of the population already had been infected and had antibodies. So this is another great news of the day. They're probably not going to be talking about this on the news tonight, but that would put the fatality rate at 0.13% to 0.26%, which again, seasonal flu, 0.1, 0.15, somewhere in that range. So this is the great news. Again, we've been talking about this all along. This is not going to be the big one. And this isn't because we did social distancing, we shut down, we tried to flatten the curve. Remember, why did we flatten the curve? We were trying to flatten the curve to keep the hospitals from getting overwhelmed. And there wasn't an overwhelm, there wasn't even a whelm, let alone overwhelm. So the staying home did not flatten the curve because there wasn't really a curve, especially in a place like LA County where there's 663 people. But they already found that 5% already had this. And out of those 15,000 reported cases, we're talking 221,000 versus all the way up to 442,000, depending on the range there. So super fascinating is that this the fatality rate, and it'll even keep going down, is going to be somewhere around the seasonal flu, which is great. So hopefully that will calm down some of your fears about getting out back into the workplace, some of those things. Still, you do distancing, you do all those things that you feel comfortable doing, but the good news is that this is not going to wipe out a quarter of the country, anything like that. We're going to be healthy and safe and be able to get through this and move on. So, practice your good immune system supporting techniques and things that we're going to be talking about, but this is not going to be 2 million people are going to die from this, even as we open things back up. So great news of the day, LA County, 0.13 to 0.26% fatality rate right now. And as they find out more people have had this, that rate will even go down. So great news. It's 3.4% like the World Health Organization had said. It's going to be a whole lot lower. So that's the great news, and we should be able to open things up a whole lot sooner than what they were thinking, and be able to handle if there is a little bit of a spike in cases or things like that. Our hospital systems are set up to be able to handle that. My parents, they winter in Arkansas, and they're in a small town there. The hospital there has laid off a third of their staff, and that's because no one's going to the hospital. They don't have any COVID cases, anything like that. So again, they weren't flattening the curve. There was no curve to flatten, and now they've actually let go a third of the people at the hospital because of that. So they need to get out. They need to expose people, and they need to be able to handle some of the cases that may come in or may not come in. But that again, great news. We haven't had the rush in most parts of the country, and so we're going to be able to handle as we get back out into the streets and working with people and different things. We are going to be able to handle if there is a rise in infections there. Yeah, Denise, that is the biggest question. Denise wrote in, why do you think New York got hit so hard? Maybe vitamin D deficiency? That is a great question. If you look at the deaths, New York and New Jersey have half of the deaths of everybody in this entire country. And so super fascinating. Why isn't downtown Chicago just as bad? If you've ever been to Chicago, my cousin lived there 8 years. She never had a car. So very, very compacted, lots of people, subways, all types of things. You look at Dallas, you look at Houston, you look at St. Louis. A lot of these places, they're very dense with people. And so maybe it was the vitamin D deficiency. Maybe it's just the stress, that everything going on there all the time. I don't know, and that hopefully we'll find out someday, because I guarantee you a lot of people aren't going to want to be moving to New York for a while because of this concern. So if you guys have any theories, go ahead and throw them up there. But that I've been looking at that all along, is if this truly was just straight across the board equal, then everybody should be having the same as New York, or New York should be having the same as everybody else, but they're not. And so that's the fascinating part, is that it's at a different level than every place else. And it's not just because a lot of places it was even there earlier. Like LA probably had it just as early as New York did, if of people from Asia and China and all these different things. So pretty fascinating things. Definitely could be the vitamin D deficiency, could be part of that. I have not seen any statistics yet on like the latitude of people in lower latitudes have higher vitamin D, and maybe they're not getting infections as much, things like that. So again, great news that we have a whole lot lower fatality rates. More and more studies come out pointing to this. A good indication that businesses should be able to get opened up sooner than later, and hopefully the government starts looking at these statistics and these facts and are able to get people out there. And I was looking at some other statistics this weekend, and the suicide rate has gone through the roof. The depression rate, the spousal abuse, child abuse, all these different things have gone up dramatically just with the stress. I spoke to a patient today, and she works from home and hasn't hugged anybody in a long time, and is just really in a down, dark state because of this. So we're as humans, we need to interact, we need to touch, we need to feel, we need to be, and that's going to be as effective at supporting our immune system as anything else we can. Social interaction, positive interactions, seeing friends, talking to friends. Hopefully everybody appreciates it that much more, because as humans, we are meant to connect, and we're meant to be with each other. Texting, looking at FaceTime, talking over Facebook, whatever it is, that's not the same. We've got to be able to interact with people. And so that's the good thing that's happening, especially in Colorado here. We're starting to open up and go through that process. Erica, can you call into news stations and tell them all these things? That's I got a whole nother story on that one. But we are starting a radio show. It'll be in 2 weeks from tomorrow. We'll have our first radio show. I'll be posting that on Facebook. It'll be a weekly show. We'll be talking about a lot about immune system, thyroid support, all types of different things. So we'll have that podcast on Facebook, but it'll also be live Thursdays from 2 to 2:30. So that'll be awesome. We just signed the details on that one, and it'll be a lot of good information, a lot of good things that we can get out to the masses. Just like you're saying, Erica, how can people hear these positive things? We can't just have the negative. That literally kills people. And one other statistic that I thought was really fascinating, if you look at the number of people that are dying every year and should have died by now in the United States, we're about 200,000 under from what it should be or normally would be every year. And so that's pretty interesting. We're almost through 4 months which is crazy too, that we're almost a third of the year done. We're down almost 200,000 deaths from where we would expect to be. And where is that coming from? Why is that happening? All those things. And so I think one of the big ones is, just like we were looking at my parents in Arkansas, 33% of the people aren't working at that hospital because nobody's going into the hospital and having elective procedures or getting on new medications or all these different things. In 2017, this was in CNBC, they posted an article on this, the third leading cause of death was medical errors. And that was over 400,000 people died that year from medical errors. And so I think as people aren't going and having these procedures and having lots of whatever it is, a colonoscopy, anything else, there is a percentage chance that people will pass away from doing those things or taking a new medication or whatever it is. And the medical errors, it was over 400,000. So that's 30,000 people a month, basically, that are probably not passing away now. So pretty interesting that we're actually lower than what we would have expected to be with the trajectory we were on over the last few years. So a lot of good news. Fatality rate continues to go down. We're opening up, especially here in Colorado. We're going to be opening up on Monday. My brother's a dentist. He's going to be able to go back to work. A lot of hairstylists. For anybody that needs a haircut, you're smiling ear to ear. Everybody, do we want to boost our immune system? Do we not? Think about it this way. We don't necessarily just want to drive that immune response all the time. We want to nourish it. We want to support our body. We want to make sure every system is working as well as it possibly can. Feed it the right way. Feed it with your thoughts. Feed it with your food, what you're drinking, everything along those lines. And like or follow us. Go ahead and put the notification button on up top, and we'll send you notification anytime we go live. Over the next few weeks, we're going to be hitting it every single day, talking about different things for the immune system, what you can do to get your body in as good a shape as you possibly can so that you can go back out into the real world and start functioning again. All right, guys, make it a great day. Take care.